All right, we have people coming on. So good to see you guys. Thank you so much for joining us this evening. We are just taking a couple of minutes to let everyone populate. Zoom webinar likes to take its sweet time to get everybody logged on. So as everyone is getting settled, I'm sure most of you have probably been in attendance for a Practice Partner Academy session in the past. So if you have, thank you for joining us again. And you know the rules, but if you haven't, the rules are, there really aren't any rules other than don't not ask questions. We really,
right.
We really
ask
like
and
you
you
guys
shall
to ask
get.
questions. That's correct. So this evening we have, you guys are all muted just so that we don't have any background noise, but that doesn't mean that you can't speak. And so I really encourage you to use the tools, your Zoom webinar tools, to use the chat, to use the question area. If you do it in the chat or the questions, we'll see it and we'll get all of your questions answered, unless of course it goes on for hours and hours, but we have contact information for those sorts of situations. So I think we'll be in good shape, but all right, we've got a good crew on. So I'm going to go ahead and tonight's topic is really, it's exciting. And the reason I want to get started is because when we've done webinars about the REMI and warts and IPKs, and we have another protocol to quickly introduce if you didn't join us a couple of weeks ago. But so it sets the stage for a lot of questions. And so I want to get us going so that when we do get to the question and answer period, we have enough time to get to everybody. So I'm going to get us going here. So tonight we have Dr. David Zuckerman. Unless, again, if you've been involved with Practice Partner Academy or just anything REMI wise, there's no way you don't know who David is. We do a lot of webinars, and I'm really excited to see so many names on here because that means that we're still bringing you information that you'd like to see. So we've got Dr. David Zuckerman. He is the founder and CEO of Zuckerman Future Technologies, and its staple product is the innovative REMI Class 4 laser. This laser has been placed in over 500 practices in the US, David, is that correct?
It's actually closer to 700 now.
It's
6 years old.
Yes, that's crazy. I feel like we just launched this baby, and I do feel like it's like a child. It's small enough. It's only 4 pounds. So it could be a kid. But the REMI is obviously the leading Class 4 laser in podiatry. And I don't want to get into too much because David's going to cover it all. But tonight you're really going to learn more about all of its capabilities, because a lot of lasers in the market really only focus on pain or fungus, and we are going to go beyond pain and fungus. However, those two modalities are also amazing on the REMI. So I am going to hide myself. I don't want to steal any real estate, and I'm going to mute myself, and I'm going to let it go.
And you'll move the slides, correct?
I will move the slides for you. Yes.
Thank you.
I'm still here. I'm not going in.
Okay.
Can't get rid of me that easy.
Okay. So welcome everybody. I appreciate you coming out tonight. This is recorded. In fact, this webinar is sort of a repeat of what we did about 2 weeks ago with the Dr. Clint Jones. We do have a copy of that webinar, but tonight we're going to really focus in on warts, IPKs, and I'm going to talk also about the MATRIXECTOmy, which is ready to go. We have the hand pieces and we have the special smoke evacuator, but let's move on. Next slide, please. Now, this is, with anything, you need to have a mission statement. I don't care if it's your practice, whatever it is. And this has always been the mission statement of the REMI based on my experience in practice. A laser's got to be effective. It's got to be multifunctional. And I hope I'm not boring by repeating this. My first laser I got was a CO2 laser. It did warts. You numbed it up, you evaporated it out. And that's all it did. And they claim it did other things. In those days, they were saying lasers could do, yeah, it could do matrixectomies, which it can do, which we'll talk a little later, comparing the REMI matrixectomy to a CO2 laser. But the key thing was I realized I spent $36,000 on the laser, and it just did warts. But it brought patients in. Lasers bring patients in. But it's not any laser. You just can't buy one laser for fungus, one laser for, when we say pain inflammation, we're talking about tendinitis, plantar fasciitis, post-op, physical therapy, neuromas, anything with pain, inflammation, arthritis, or lack of mobility. That functionality and portability is very important. And we are in a business. You need to make a quick ROI. I've had so many podiatrists that I've lost count that are paying off their laser with months and not years. You've got to make, obviously the best way to make money is to have an effective modality and be a good clinician. I always say that it's very important. The laser is not as important as the doctor. It's the clinician. The laser does things that helps you become a better doctor, but it's a tool. Effective marketing. Well, look, you need to have good marketing. We include the marketing. That's how important it is. I'm a big fan of in-house marketing, posters, brochures, TV videos on your website. We customize those marketing materials. I've had very few bites on this, but to me, the doctor, we have videos explaining the pain, explaining the onychomycosis, but it's the doctor. It's important that the patient see the doctor talking about the laser, how it helps the pain, how it helps the fungus, and then because they want to hear it from the doctor. So you need to also have, and I don't want to, tap my shoulder. I am dedicated to this. My most exciting day is training somebody on the REMI, supporting them, answering questions, helping you do well and be successful. That's my goal. Helping you be successful. Next slide. This is the REMI. It's 4 pounds. It's multifunctional. That's so important. And it's also now does matrixectomies. It always was FDA cleared for excision, ablation, coagulation. that part is insurance covered because it's a surgical. The REMI is both therapy and surgical. Excuse me for 1 second. I'll explain to you what I'm doing. Hold on. I don't know if you realize, but the REMI is named after my 4-pound Yorkshire Terrier who's gone in the office, out of the office. He's driving me crazy, so I had to go open the door. So I apologize. So the next slide, it has to be affordable. The REMI is under $16,000 with a 5-year warranty. Services were important, which I never mentioned. All the REMIs are serviced. We have a less than a 1% repair rate with the REMI. It's an Android, which means that all the software can be updated from our server. If we cannot repair a REMI in 3 days, we put a loaner in. So it's real simple. If it needs repair, we send a mailing label, pick it up, take it down to our repair center, fix it. Usually it's very minor things that need to be fixed there, but when they do, I can't remember the last time I put a loaner in because we got it that quick. So here's warts, pain, inflammation, fungus toenails, neuropathy, post-surgical. I don't know if you know much about lasers. All lasers are therapy and they're good for healing. They're good for wounds. When you're doing a post-surgical case, you should do it right with the stitches in. It will reduce surface bacteria, reduces the chance of infection. It will also reduce post-op pain due to excessive inflammation. The incisions here heal much better because you get less, inflammation and less, excessive fibrosis. And in veterinary medicine, every incision gets treated. And it's only a minute, maybe 2 minutes. And this is, I always tell doctors, if this is my personal opinion or is this the literature? This is in the literature about healing. Wound healing is just phenomenal. Next slide. This is just one case. Does every case happen like this? No, fungus is tough. We'll talk about Photo Expert a little bit, which has really helped improve the outcomes. The FDA 510 clearance for the REMI is close to 80%. If somebody tells you it's 90%, I just don't believe that. But there's other things that we can help you to make it a better outcome. But this is not atypical. I've seen lots of these. Next slide. Photo Expert, very, very quick. This is an evidence-based. I am financially involved in it. The name of my parent company is Zuckerman Future Technology. We try to bring future products to the present, which I believe the REMI is. And Photo Expert. Photo Expert is a product. It's the only evidence-based, peer-reviewed, published product that, if you remember in school, if you have warts, the lipid barrier is damaged. If you have fungus toenails, the lipids barrier is damaged. And through biopsies, if everyone wants to see the article, it was published. They did biopsies and showed that through a lipid tube barrier system, that they actually showed the repair of the lipid barrier under electron microscope. It's a big game changer. Next slide. Here we have warts. We've been doing warts for years with an S. The beauty of using the REMI is, and we have different techniques. I have to tell you, there's no consumables. The tip can be sterilized. And the beauty of it is, I'll never forget a few weeks ago when Dr. Jones was on, he was saying, it takes time. The way it works is it stimulates the immune system, and this is in the literature, and it also coagulates the capillary bed. And these patients, there's no wounds, there's no needles, they're able to walk around, they can do most of their activities, and the pain dissipates. You know, if they come with a painful wart, it dissipates pretty quickly, as opposed to sal acid. I'm not putting I used the sal acid. You master this and you will have patient after patient after patient coming in. The key is with the REMI, with anything you do, you have to put his time into this and learn the fine intricacies of this. Next slide. Fetal, this was, I don't know why it says warts, but it's okay. This was put together by Dr. Jones, talking about pheno. He was using CO2 lasers for matrixectomies for 25 years. I started it. I always wanted to touch it up with pheno, but he has mastered the REMI matrixectomy, and I do congratulate him and show my appreciation for fine-tuning it. Anybody that wants to get involved with the REMI matrixectomy, he will be doing the training. He's done so many of these. It's not we just started it. It took almost a year to get it developed. It's pretty beautiful the way it works out. But if you talk about pheno and matrixectomies, which I'll just touch on because the slide's in front of me, you don't have to worry about back orders. It's the REMI. You just turn it on, set it up, and you're gone. That's it. There's no major setup. There's no inconsistency with pheno. You're seeing the results when you use the matrixectomy. People use it for a minute, pheno, 2 minutes. There's so many different techniques. It's very replicable. You can replicate it. One more forward. Okay. So, you can read this about the REMI. This is for matrixectomies. Big difference. We do have a special course that will be required, and you'll be certified to take it when we do matrixectomies. It's worth it. I don't know it all or claim to know it all. One of the things I've learned is I get people that are excellent in aspects of it. I know how to do it, but he's done it for a while now. He's got tremendous experience. Next slide. This is more about, comparing CO2 lasers. I don't know if anybody has the CO2 laser today. I had one. Big difference between the REMI, especially since it's multiple functions. It could be ablative and non-ablative when you're using warts. You can numb up a wart and use the REMI like a 15 blade and cut it out, or you can do another program, and they're all FDA cleared, 510 FDA cleared, where you can use it with no anesthetic. You can actually, I don't know if you can see me, but I'll show you some of these hand pieces when we're done. Next slide. Next slide. This is a technique. This is the contact, no anesthetic. This was Dr. Oliveira from Ohio. You can see him, he's touching it. No pain. And it's the technique. You can't now. He's going side to side. I teach where you touch it and pull back. It's the heat that could hurt, but he's mastered. He's been doing this for close to 3 years now. He now has 2 lasers. He started with 1. Patients can walk around. There's no Band-Aids. There's no dressing, sterile dressing at all. The end point with this is black, a little bit of white, and brownish, and you're done. It's not the time. It takes about 1 to 2 minutes to do it. And this, I've cut this out. I just want to show you how he does it. Now that tip can be sterilized well over 10 times, autoclaved. So the beauty is there's no anesthetic. It is insurance billable. I tell patients it takes anywhere from an average between 1 and 10 treatments. There's a case we're going to tell you that was more than 10, which was a horrible case, and it resolved, which is important. You know, patients will come in and have treatment done when they know it doesn't hurt. It's quick, it's fast, it doesn't get, and it doesn't take them off their feet. They're ambulatory. Next slide. Now, this is a case. If you look at the top left, this was one that was, this is Dr. Jones treating it. No anesthetic. You're going to develop your own technique. I'm going to teach you the principles. I think they're going too fast. You got to go slow. In fact, when the laser operates, it beeps. It's beep, you touch it, another beep, you follow the cadence of the beep. But this one in the upper left, we're going to show you more of this. This was one that was upper right, excuse me. Failed all over the foot, failed CO2, cryo, had scars. The guy is 99.9% has no warts at all. And it took about 4 months, but patients will come in for a 5-minute treatment and boom, they're gone. When I say gone, they leave the office. Next slide. Now this was done by Dr. Rodriguez. This is his goddaughter. He did his daughter. Now this is his daughter and his goddaughter hand, but he's not touching it. He's getting excellent results with. This is another way to do it. If it's uncomfortable, you can do that. You're stimulating the immune system and you're creating a hyperemia. It will turn a reddish, purplish, similar to a flash lamp pulse dye laser. That's another technique you can use. The key is to do this almost virtually pain-free. It's another technique. When you get a REMI, we train you. I personally will train you. We have manuals, we have videos. The key with warts is take your time. That's the key. Don't rush it. Next slide. This was a compliments of Dr. Jones. And it shows you using these warts, standard wart codes. And he did nothing but switch to the REMI laser. And he went prior to June of this year, I think it was this year, look how many more procedures he's done. He relates this to the fact that it's quicker, it's faster, the word of mouth. Hey, it didn't hurt. It took 1 to 2 minutes, and I'm able to go back to my activities. He talks about on the next slide what really showed him the difference was that he had we have these Google review guides, and he was doing a track runner, which he did a CO2 laser. And, there's always 2 sides to a story. You're going to tell something, patients don't remember everything. And the guy was running on a sore foot, painful foot, because he numbed it up and did a CO2 laser, and he got a bad review. What he's found out, and he truly believes this, I don't know if it's 100%, it's not if he can get rid of the wart, it's when can he get rid of the wart. There are some warts that are going to be, if you're autoimmune or, and you are immune compromised, I don't think you're going to get rid of warts at all because, but this is a procedure that can be repeated over and over and over again. I mean, I was shocked. He was one of my most skeptic doctors. I still can't get him to do pain. He does fungus, toenails, and warts. And that's the beauty. You can pick out what you want to do. His office is so busy. He doesn't have the time for pain. In fact, he just got another laser. He's now got 2 of them because it's so busy in there. It's the beauty of the REMI. It comes in a customized carpet. You can just pick it up by the handle and then boom, 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 go in the next room. It's very quick and fast. Next slide. This is a poro. You can see the final resolution. It's excellent for poros. We're not 100% sure why. I think it will seal the duct. It could stimulate the immune system. The beauty of Poros is that we don't have any good treatments at all. I mean, I used to sow acid, inject it with 4% sclerosing, painful. Now we have something that if it doesn't cure it, it reduces the need for the patient to return. Who everybody that's been in practice for a while can remember the patient coming in. They come in once a month to trim those little seed corns or poros out, and you're torturing them, and you don't really want to see them. They can be nice people. It's just, you're frustrated, just like they're frustrated because you can't get rid of them. Now there's a treatment modality that nothing's 100%, but it's significantly. I've gotten reports back. I don't know if it's in this slide projecting where I always text doctors and ask them for feedbacks of me. That's most of my time is communicating with the doctors. They're telling me close to 90% of the time when it's non-weight bearing over a metatarsal. If it's not under a metatarsal, you're going to get very success. If it's under the metatarsal, that's obviously a bony pathology, and it's less effective. But it shouldn't be. It should be attempted. Next slide.
David, just so you know, I don't think this is going to happen, but just in case something weird happens, I'm having a major storm here. So
Okay.
Should my power go out and this goes black, that's why. I don't think that's going to happen, but I just want to give you a heads up just in case.
No problem. Things happen. We had a terrible storm 2 nights ago. I mean, it was like tornadoes. It was miserable. We didn't lose power though. I don't think it's going to happen, but I just want to give a heads up in case it does happen. It's not like no problem. Now, here's a case on the left. There's a wart. This is what was one treatment. 3 treatments on the right. Now, could you put canthrone or sal acid up under the 4th toe? That would kill them. That was, I know it's not written here, but that was 3 treatments. It does work. The Remy has stood the test of time with poros and warts with no anesthetic necessary. Next slide. Very, very quickly, if you want to see it, I'll just go by. We have a whole, this is Dr. Jones doing the MATRIXECTOMY. This is the new handpiece that was designed. It's actually, we have it now where the vacuum hooks right into the handpiece. Yeah, we can move on. That's something I wasn't going to focus on tonight, but we do have, if anybody wants to look at, this is a special we're having, which I don't want to get into details. The attachment that you can see, there it is. There's the hose hooked into it. That's now included with the Remy, the attachment. But we'll talk in the end about, I'll have a little surprise for you. Next slide. Marketing is very important. I've been very fortunate to have Sarah be involved with this. I never thought it would get to this extent. If you want to talk about Sarah, I can, but marketing is important. Do you want to speak a little bit about the marketing? It's very important to have good, effective marketing. There's posters. You want to make a comment?
I can do that. I'm trying to turn my camera back on, but it doesn't want to let me. I'm here. Yay. Okay. Yes. So this is just part of the program that David offers. And we are in the middle of actually updating a lot of our materials right now. So what's exciting is if I am seeing some names of the attendees right now. I know some of you already have the Remy. And so I will be reaching out to you to give you an update on materials, mostly the videos. So look for updates to the patient educational video on pain, the educational video on fungus, and then I am finishing up the educational video on warts right now. And right now as well, the trifold brochure is a combination of pain and fungus. We are going to be providing you individual protocol brochures for each treatment. So it's going to be a brochure just about the pain and those specific conditions, plantar fasciitis, Achilles tendonitis, are obviously being 2 of the major pain points. And then the fungal toenail brochure, and then obviously the warts. We also currently have, not a lot of people request it. So, but just so you are aware, we do have a specific brochure about neuropathy and wounds. So if that is something that if you already have a laser, and you would like that specific brochure, please just let me know. The good thing about working with somebody like David, and then as an extension, somebody like me, we don't really answer to anybody. So if you ask for it, we can do it.
And that's very true. And we've had some great pull-ups, banners on walls. I personally, like, you've done some signs also where you know.
That's the thing. Yeah, like part of the initial toolkit didn't include like window decals or anything like that, but somebody asks for it, sure, I can knock that out for you.
Yep.
It can be confusing if there are specific specifications. Like if you have an outdoor sign that it's like, your specific height, width, all those things, those are obviously, take a little bit more time to customize, but there's nothing really out of question unless
I like, Sarah, I like the word laser center or laser heel pain center or laser in their sign, so lasers attract. They attract attention, the word laser.
Yep. And that's the next slide actually is talking about creating a laser center. And it really comes down to, how you brand your practice. And if you are a laser center, you are differentiating yourself from family, foot, and ankle, right?
Yep. True.
How many family, foot, and ankles do we have?
Yeah. My goal has always been, with the permission of the doctor, is he's doing something else. It's here we are, laser center. It's within the practice. I certify all the staff and I make sure it works. But the doctors, he could be in the hospital, he could be seeing other patients, and it's working independently of him. And many states, the doctor doesn't even have to be on site. I recommend it, but it's important to, it's like an annuity. It's paying for itself. And even if you use the physical therapy or the pain aspect of pain and inflammation of the remedy, it's working independent of you. That's always been my goal with everybody, and that's what I strive for. People have different ideas. We have laser fungus centers. There's lots of things, but I always try to find out what your goal is. I always say to doctors, I'm going to tell you what I think, tell you what I want to do, and then you tell me if it's okay. Next slide. There's the marketing again.
I have no idea why it went backwards, but there we go. I went forwards and it just wanted to have a mind of its own.
It's funny, when this presentation was put on by Dr. Jones and I, it was 90 minutes. I've cut it down to almost 30. But this is everybody knows this is my contact. You can always text me or call me at 856-229-2939. At this point, does anybody have any questions? I'm very happy to answer it.
Yes, we do have some questions that have popped in. Let me get my camera back on here. I don't know why it always, there we go. I come out of the darkness.
It's getting dark.
It is really dark. Okay, we have not a ton of questions, but we've got a few, and hopefully this is the time. I encourage everybody who's on to ask your questions, and literally it can be about the warts, the IPKs, the new protocol, and then our standard protocols that have been, these are the warts has always been since the beginning, but again, kind of traditionally, pain and fungus is what everyone is used to. So ask about all of the different capabilities of the system. So, all right, David, our first question: what type of reimbursements are you seeing for warts and or matrix? Remember, I get tongue tied every time.
MATRIXECTOMYs.
Yes,
okay,
I just
for warts,
can't say it.
for the warts, it's anywhere from $80 to $100 per session. It's an average of 3 to 5 sessions, but we never tell the patient it's 10. So case-wise, we're talking probably $500 to $600 per case, but it could be more. The global period's 10 days. In Europe, where the REMI is, they do it once a month. United States, they do it every 10 days for obvious reasons. You can't over-treat it, but it takes time. Even when you treat it, you're not going to. This is not an ablation. When you coagulate, and I want to make one more point. One of the things we're doing for people that haven't learned the technique a little bit is we take the pain aspect of the REMI and we treat the whole bottom of the foot where the wart is, because when you're using pain, inflammatory therapy, it numbs the area. You get an analgesic effect. So we're doing that also. But most of the time, you don't need that. But there's always a tough case. So on a matrixectomy, it's the same reimbursement as whether you're using phenol, sodium. I always say if you even with warts, you can bite it up, chew it up, pick it out, whatever you're going to do. It's the same reimbursement. So there is no additional reimbursement. I've seen doctors many years ago when we had CO2 lasers charge more. I don't recommend for matrixectomies. I don't recommend doing that. But the beauty is with the consumer, there's no major consumable with the REMI. There's no, there's some treatment modalities where it costs $50, $60 per tip. The REMI's not. I never set the REMI up. The worst thing I hate is somebody is trying to make a living off you for consumables. It should be off of the product itself. And the REMI, the interesting about the REMI, a couple things that I want to point out, and we'll get to the questions because I don't want to forget this, because I have something that's really been helpful, and as we just started this, is for people that finance it, we now have a $99 per month for the first year payment, and then it locks in to you have to have good credit. I'm not going to lie to you. You can't have 50 bankruptcies, but for good credit people, where can you get $99? I was doing deferred payments when I first got in practice, because especially for a new practitioner, anybody, you're not putting you get a chance to make money. And I got to tell you, we have people, I could give you testimony after testimony, people are getting a high return on investment with a REMI. So I hope I answered the question. We've got the $99 per month. There's no major consumable. If anybody wants more information, they just email, and I'll show you examples of the actual, I was shocked at the interest, the simple interest rate, how it was. I have brokers that they shop around all around the place. So we do get you the best rate. So that's warts. The point is that the laser, if you make patients better and faster and quicker and easier, you're going to get more patients and you're going to get happier patients. But it's not an extra, it's not, you're not getting paid more for using the laser, whether you're using salicylic acid or cantharidin. You're just not getting that. But there's many advantages, which you're going to get a recording this, go back and look at it, because cantharidin hurts. Salicylic acid's messy. Patients, all they have to do is rub the Poto Expert on twice a day and it starts repairing it. There's no hole. There's no hole, there's no wound, there's no chance of infection, there's no bandages. So that's, hope I answered your question.
So you're paid the same, but you're just going to get more patients. So
correct.
And more money, right?
Yep.
Would it be beneficial to do an elevating osteotomy on lesions under metatarsals to increase the success rate?
I always, if there was the plantar flex metatarsal, I always went for the bone. That was me. I just never, ever, tried to scrape it out. I have had cases where, it was a plantar flex metatarsal, and it turned out it never went away, the lesion, and it was a wart. You can have a plantar flex metatarsal with a wart that's aggravating it. So if there's a bony deformity, I go for the bony deformity. That's me.
This is a question you have maybe gotten this question in the past, David, but I haven't ever seen it. So I'm interested to know, if somebody already has a laser, not a REMI, do you have any sort of trade-in program situation?
It all depends on the laser that you have. I got to tell you, that's why you can't spend $30,000, $40,000, $50,000 on a laser, because they depreciate like crazy. I'm always willing to talk. I'll give you an example.
Well, it's an Aspen laser. I know you're very familiar with. Yes.
Yes. I did work for Aspen at one time. I was part owner of the company. There may be some modifications we can do to your laser to make it work, or do a trade. I'm very happy to talk to you about it. But I'll give you an example. Pinpoint laser. I don't know how many pinpoint lasers. I work in the industry. I call up a major mobile company, and we sell it to them. If I can find a way, I will help you in any way possible. So it's not a yes, or it's definitely not a no, and it's not a yes. It's let's discuss your individual case. If I can figure it out, I will figure it out.
Are goggles required? I know the answer.
Always.
That's the only one I'm going to know the answer to.
Always. In fact, when the laser turns on, it says put your goggles on. You should. Oh, and I'll tell you another thing. Don't buy these LED goggles on the internet for Amazon for $19. The REMI laser goggles are not expensive. I don't triple or quadruple the price of them. I think they're like $65, but you need not only the wavelength, but the optic density has to be at least 6 or above. They're your eyes. Take care of them.
How many times do you recommend one laser? Okay, hold on. How many times do you recommend one laser for? Okay, I think there's just like basically how many procedures for toenail fungus. I've seen a protocol that says 3 times in 3 months. So come in once a month for 3 months.
Okay, that's a good question. You want to say to the patient, and then I'm going to talk very briefly. I don't want to take too much time of the staff, but how I present a fungus toenail. I train assistants and how they should talk to them. But anyway, the FDA clearance is an average of 3, but you got to tell the patient it's an infection. Okay. And it took a long time. The average is 3. It could be more. It could be more. I mean, we know it's 30 days apart, but you can't over-treat it. And here's a presentation that we talk about. This would be the assistant sitting there who's doing the procedure. Well, how does it work? They're all going to ask their how it works. And it's a cosmetic procedure. I'll pretend you're the patient, Sarah. Have you ever heard of collagen that makes your face very pretty and smooth?
Of course.
Okay.
I obviously have not been using it.
It doesn't matter what they say. Well, not only does the Remy laser kill fungus and bacteria, it produces collagen, and this is a fact, and it makes your nail healthier and prettier. Patients are coming in because they don't like the way it looks at all. We always tell patients that you go over the options. Well, if it was 20 years ago, this is the doctor talking to the patient. It was 20 years. First of all, if you're talking too much to the patient, your marketing sucks. Okay, I'm going to tell, or it's got to be education. They should be educated and asking for the procedure. If you notice you're saying a lot, go back to your marketing. But we said, say to the patient, look, there's multiple ways to treat this. One is we could remove your nail, just like you pull a tooth. They don't want that. 2 is Lamisil. I don't frighten people in the Lamisil. It's going to hurt your liver. I can get into that aspect of it, but they don't want Lamisil. Okay. And I said, our goal with this treatment is to reduce or eliminate the need for an oral medication such as Lamisil. That's why we've invested in this laser to help you avoid the Lamisil. And they like it. I can show you techniques. If you have a tough case and it's not responding, you only need 14 days of oral Lamisil. I'll teach you that protocol. We have lots of different protocols. Most people with fungus toenails are doing the 3 treatments 30 days apart using the Poto Expert and Remy fungal program. We also I can teach you micro drilling. Years ago, I used to do this micro drilling. It was called Clear Nail. Great technology, bad equipment. We've now developed it where you pop your own little holes in there. We also have photodynamic therapy that I can teach. There's lots of things, but I like the popping of the holes. If you don't want to debride the nail, you just put little holes in the nail. So any more questions?
Yes. If somebody already has a Remy, how can they get the new treatment protocols on their system?
You just reach out to me and I put them in. I just, put a little camera on there and put them in.
Very good. And Dr. Dye used a word that is way too big, and I just had to Google it. It's spider veins, a medical term for spider veins. I can't pronounce that. So can the Remy be used for spider veins? But
I'm going to say yes, and I'm going to say no. And the yes is the wavelengths. I've been working on this. we just don't throw the protocol out there. We test it. We're still testing it. And I got to tell you, it needs more work. I may down in the future with probably, I don't know how long it's going to be. I'm always looking at new versions. Someday there may be a 6-wave Remy where it's going to have a 535 wavelength in it, which is very good for spider veins. Or the 980 is not a bad technique. But unfortunately, the doctor that we're trying to learn it from, we have the protocols, we've been testing it. He doesn't speak English. So we're still testing. We haven't mastered it. I have the protocols. We have the hand pieces. We haven't mastered it. But the standard is a 535 wavelength. And another thing is called the blue light. I may be putting blue lights. I'm always thinking of making it better and better and making more multifunctional. So I'm always looking at the future. I mean, I have the future of the Remy plan for the next 5 years. You know, you'll see. There's nothing wrong with the Remy of today, but you know, you always have to improve options for the podiatrist and other fields. They can offer more with one laser.
Those are all the questions. I'm going to give everyone a couple more seconds to.
I have a question I would be asking.
Okay. Oh,
Okay,
of me?
No, just if I always tell doctors after I talk about them, I said, here's the question you should be asking me. Service. Service is very important. I promise you, you're going to get great service with the Remy. In 5 years, you know, the warranty's 5 years. What happens then? You know, what's the most you have lasers out there. I'm telling you, some of their attachments could cost you $5,000 to $6,000, $7,000 5 years down the road. The Remy, the worst thing that can happen with the Remy is a diode. That's the wavelength, produces the wavelengths. By the way, the Remy is a multifunctional. It's a multi-wave. It's 980 and 810, which I think has a lot to do with why the fungus is improving. It's not a single wave. We do know that dual waves are more effective than single wavelengths because they penetrate more. But the Remy can be fixed. It's really a dental laser. It can be fixed by anybody, any company. I have companies out there that I've tested this already. Can you fix this? Yes. When I tell you, I check it. I'm the type when I walk into a movie theater, I look to see how many exits there are, not just one. So the Remy, if God forbid something for happened to me, what's going to happen? The Remy will continue without me. There's people behind me, service. So the worst thing it can cost you is $1,500 if you need a major repair of the Remy 5, 6, 7 years down the road. There's some lasers out there that they're called the boutique lasers, where they have their own special patented wavelength. I'm not going to mention who they are. One of them was Numir. Numir, I don't know if you know the Novum. It was a great laser. Great laser. But
I'm not going to mention who they are.
What? Well, they're out of business. Okay, they're out of business, and that's why. This is before probably half this group on here even, you know, we're out of podiatry school. It was the greatest laser in the world, and it was really effective. You put little clips on it. The problem is nobody could fix it if the company went out of business. You had to go back to them. To this day, you know, they're sitting around collecting dust. It was a good laser too. It only did fungus toenails and wounds, but it was a brilliant idea. I could never get the owner to listen to me. And it would cost you $200 per session of nails. It did 8 nails. Can you imagine it did 8 nails? He was a dentist, Bornstein, Eric Born. He was a great guy. And it only did 8 nails. What about the other 2? He only designed it so it did 8 nails. I'll tell you a future thing I'm working on with the Remy, which hopefully maybe might be a Christmas present for everybody, is it'll be a minute a foot, where you'll take the handpiece and you'll just run it all at once, 5 toes at once. I'm always working to make it quicker, faster, but it always has to be effective. And when I say with spider veins, we don't have it yet. It should work. We don't have it. There's literature. You read the literature. They give you all these great results. And a 980, it's not working. We don't know why, but we don't quit.
All right. Another question did come in for IPKs with the Remy. You mentioned 3 treatments. Were those every 30 days as well? No, that's different. The fungus is every 30 days. And that's what it's a minimum of 3. I have doctors that do it once a month for a whole year. It's a minimum of 3. I don't care, but you should do it every 30 days. It's not going to hurt anybody if you do it once every 2 weeks. You can't overtreat. You're talking about IPKs. It's the response. I've seen warts IPKs go away with 1 shot. You know, and one thing that's important is don't debride the area. Okay, you treat it and then you debride it because you need the callus or whatever it's there because it will absorb any excessive heat. But it's a clinical response. It's not, you know, 3 treatments, it's gone. The average is between 3 and 5, somewhere in there. But it's a clinical response. With warts, you know, I can tell you one thing that's going to help is with IPKs, when the pain starts going away, you're really done. Then watch it. See, to trim it, watch it. See if it's not responding. You can see the duct. I mean, it's hard for me to describe it. I know when you trim it down, there's a duct there. Hit that duct until it changes, until you get striations. That's with warts too. You have to get the capillary, the pin. It'll turn black specks, and you'll see the lines. The skin lines will go back to normal. They go around the wart,
And when they're normal, they go through the wart. But there's a clinical, I mean, I could show you pictures as podiatrists, we've seen a million times. When the wart's getting better, is you see the skin changes. But you can't overtreat it. It's not like, oh my God, I overtreated it. You're not cutting anything when you're using the non-ablative. It's not a cut.
All right. Those are all of our questions. Did you have anything else that you wanted to close out with, David, before we sign
No,
off?
but a couple things is one is any questions you can think of, you can text me, email me. This is included with anybody that purchases the Remy now. Okay, this is the fungus toenail attachment that goes with it. There is a vacuum system we'll talk about later. That's not included.
The fungus or the...
This is the excuse me, the matrixectomy.
Okay, that's what I was gonna say. I was like, it doesn't look like the
this is the matrixectomy. This is the, let's see, this is the fungus.
There it is.
This is the wart surgical tip. And you just take this off and clean it off and you can pop it in an autoclave, which is really, really nice. Don't forget, we do have the $99 per month program. If anybody wants to talk more about it, I can send them information about that. I'm here to help you. I think this is the perfect time to get a laser. There's never a perfect time. The perfect time is now. That's what I mean. It's now.
Right. Yeah, there'll always be a reason not to do it, right?
Yeah, you can't lose money on the Remy. I'll tell you one thing. If you don't finance, because the bank owns it, and you pay a credit card or check with the Remy, I give everybody a 90-day return. If they don't want it in 90 days, it didn't work out, I don't like it, I'll just take it back and give your money back. Nobody will give you that type of
I was gonna say, that's
I don't want it.
risk.
Yeah, I don't want it sitting and not doing. I want it helping your patients, which is going to help you do well.
Right.
Okay.
Awesome sauce. All right. That's
Thanks.
gonna conclude tonight, everyone, which is probably good because there's like lightning beaming at my face right now from the window. So I appreciate everybody showing up. Thank you so much. As
Thank
always, these are recorded and you can find them on our Practice Partner Academy archives page at podiatrymeetings.com. If you want to contact Dr. Zuckerman, it is David Zuckerman DPM at gmail.com. But that's also, if you go to podiatrymeetings.com to our marketplace, the Remy laser, you will see a lot of information there. And then obviously you can just go to remylaser.com as well. That's also very good. So all the contact information is there, tons of videos, lots of training videos, lots of testimonials. So if you need anything, contact David, you can contact me. We have so many materials from when we launched in 2018 till now. It's astonishing how much content we have. So if there's something you want to see, it's likely that we've got a resource for you.
Yeah. Great.
All right.
Thank you so much. Have a great night, Sarah. Thanks.
Be good, everyone. Be safe. See you next time.